Hello everyone, my name is Matt Viegas. I am currently a student, a DPT student, Doctor of Physical Therapy student in my third and final year and enjoying my clinical internships right now. So now that I'm actually seeing patients in the capacity of a physical therapy student, I just want to share some thoughts about my experience with pediatric rehab. And for me, that's because I grew up with right brachial plexus nerve injury. It's this bundle of nerves that's here in between the shoulder blade and the collarbone, and can occur at birth, or for people who are riding motorcycles and get in a horrible accident. So basically, because of that nerve damage, I was born at Alameda Hospital, where I was born and raised, and I actually spent the first few days of my life in Children's Hospital, Oakland. And I don't remember that time. My mom would know much more about that, especially as a nurse and taking me to all my appointments. But I did have follow-up visits for quite a while, because brachial plexus injuries are a serious thing, and I've been very fortunate to be very high functioning. So external rotation, which is for the shoulder, sort of moving my hand up, and then supination, which I guess you could say like Beyonce single ladies, and like turning the forearm that way. Those are the movements that are most difficult for me. But aside from that, I'm pretty lucky. One of the cool things is that today I did this thing with like pinching your shoulder blades, scapular retraction, and I'm using free weights, and I've been doing this for a while, but I've gotten up to 30 pounds today. So that's something really cool. I definitely didn't do as a kid, because so going back to pediatric rehab, it focuses a lot on play and a lot on functional things that you would do in school. And I've been lucky that I really have great use of both of my hands. So I've had physical therapy, I've had occupational therapy, I've actually had speech therapy as well as a kid. I'm sure I'm actually leaning towards pediatrics after I graduate. I'm sure I'm going to find out way more about how that coverage works and all that jazz. But basically, what I wanted to share is that for me as a kid, like I definitely saw that split, that dichotomy between the clinic and the school, home, and just how people interacted. And even though it's focused on movement with physical therapy, with occupational therapy, and using my hand as much as possible, and trying to play around, it's definitely weird when you're a kid and with an adult, with a stranger. So I guess that's really the highlight that I can remember. For my older age, when I was in 4th, 5th grade, when I was like 10 years old, I would try more higher functioning things, because I was higher functioning with my injury. And so I could do things like demonstrate push-ups and do whatever home exercise program they wanted me to do, which knowing now as a physical therapy student isn't that great. Doing like raising up and down flexion with TheraBand, it's really not that great for a kid. So I'm glad to be doing free weight exercises now. That's definitely something that hopefully I want to offer as I go through my clinical experiences and eventually graduate and hope to become a pediatric PT. So those are really the thoughts I wanted to share there. I'm going to talk more in depth about my pediatric rehab experience as I go through with my blog series and on my podcast, the Capable Body podcast, sharing more about my patient story and scheduling those out, because coming up I'm actually going to enter a grind like January through April, a grind of studying and having to stay off social media. So I'm in the works right now of developing out a blog post series that goes more in depth about this pediatric rehab experience. So moving on to the thing I really wanted to talk about. So inspiring kids to become physical therapists. I was in that unique situation where I knew about physical therapy from a very young age. I don't think many people have that. Maybe it's like for a relative or something, but having that personally. And one of the things that really just popped into my head today as I was going through my clinical internship is like, why don't more kids say when I want to grow up I want to be a PT or an OT or a speech language pathologist, which are truly very rewarding professions where you get to spend time with patients and do things that are really meaningful and really helpful. And as you get to my age of like actually having to go through all the prerequisite courses and all that jazz and interviews and whatnot, and finding that it really is rewarding, but for whatever reason it's not that well known with the rehab team in healthcare. But for whatever reason, kids can say I want to be a doctor, or I don't think they say I want to be a lawyer, but definitely say things like I want to be a firefighter or I want to be a police officer. And I'm not like bashing on any one thing, but speaking for like doctors, I definitely know that as far as branding for the medical profession, kudos to whoever goes that route and really does want to do that. But I would definitely say chatting with other physical therapists and physical therapy students that a lot of them like were originally thinking of pharmacy or originally thinking of becoming an MD, and then suddenly realizing that, hey, there's this thing, physical therapy. And I just personally think that like when you're at this later age, when you're trying to go through your whole application process and admissions and all that stuff, I really think that's so late for a healthcare profession to know about it. And I don't know, I'm just in that unique situation where I knew about it as a kid, and I just always liked sciences and I wanted to sort of, I guess, keep my options open, just because I'm just the type of person who doesn't like to be locked in to any one thing, but I kind of need to do that because it's getting closer to graduation. But yeah, sharing more with kids to say that they want to be PTs growing up, and not just saying that, but actually showing. And the clearest cut example I could think of is freaking like Apple with their whole convention and that little keynote with the Apple Watch, and like this could save people's lives if they have, cardiac arrhythmias that they were unaware of, or just showing like these Dear Apple videos, which are testimonial videos of how that Apple Watch technology has impacted their lives, when we have this, for whatever reason, hidden healthcare profession that is so rewarding and so cool: physical therapy, occupational therapy, and speech language pathology. And for whatever reason, I don't feel like there's enough school kids saying I want to grow up to be that, because it really is a cool thing to be part of rehab. So I'm gonna leave it at that. If any of y'all have questions, comments, or things you want to add, please do share and I will look at that. But anyways, thank you very much for watching and tuning in, and hope to catch you next time. All right, adios.